Hi, everyone. This is Dr. Diane Hayden, publisher of Natural Nutmeg magazine, and I'm excited to be bringing you our series of Lunch and Learn videos, which we started this week in response to COVID-19, with all of our expert writers and contributors from Natural Nutmeg on how to cope with the situation. And other topics are going to be just uplifting interviews on everything from natural therapies and how to live a more holistic lifestyle with tips that you can easily integrate into your daily life. So today I'm excited to have with me Dr. Adam Breiner. He practices naturopathic medicine at Whole Body Medicine in Fairfield, Connecticut. Patients from Connecticut and surrounding states seek his care for Lyme disease, brain injuries such as stroke, concussion, TBI, as well as enhanced brain performance. So thanks for being with us today, Dr. Breiner. How are you?
Thank you, Diane. Thank you very much. Good to be with you. And to all your listeners, readers, I guess worldwide now, because you're pushing this on the web, right?
Yeah. Yeah, absolutely. So obviously, every practitioner is dealing with this in their own way. I've had a lot of interesting discussion this week already. We had a mental health expert on Monday, and just curious as to, what you're seeing in your practice and what kinds of recommendations you're making to your specific patients as far as prevention and treatment of COVID-19.
Right. Yeah, we're doing a lot just on the preventive side. And some of that is some nutritional recommendations that we're asking patients to, do now, including certain therapies like intravenous nutrient therapies, which is really, really important. I can touch on that in a moment. But even just at home, getting extra vitamin C in, zinc, okay, really important. There's some very good formulas that one can take to enhance the immune system, like things like astragalus and some of the other mushroom extracts and things. I mean, we're going to be posting that on our site soon, so if people want to get that, they can get those. Vitamin D, super important. So we're asking everyone to make sure they're upping their vitamin D, 5 to 10,000 IUs a day, and encouraging them to actually get their blood levels tested so we can more precisely have them do what they need to do. And if they need to be referred here to another doctor to do, for instance, a vitamin D injection to even get it up quicker. So, but IV immune therapies are really amazing. And the reason being is that, a lot of people have issues with absorption, just even if everything's going great. And I'm sure you've had some guests on and articles in your magazine about digestive issues,
Mm-hmm.
and that's an issue. But also just how much you can get from your food and even sometimes supplements. But when you're doing an intravenous infusion, you're bypassing all the digestive tract, you're bypassing the first pass in the liver. So you're getting it right into the cells, right there. So imagine your white blood cells are marching along having to fight infections. And, COVID is one of those, hopefully you're not getting it, but one of those types of infections. And it's like soldiers going out to the battlefield without bullets in their gun. So by giving some of these, B vitamins and zinc and trace minerals and a lot of C, we're doing a lot of high dose vitamin C, and I'll describe that in a moment, but that will really help the immune system and hopefully give everyone a better fighting chance when they do come in contact with, infections, be it COVID or anything else. I think that's really important that, this is not the only infection out there. And building the immune system, keeping, these stealth infections that can be around are very important. You mentioned that we see Lyme patients. We see a lot of Lyme patients. And Lyme disease is caused by Borrelia burgdorferi, right? That's the common bacteria, the spirochete that they talk about is causing Lyme disease, and that causes a lot of the symptoms of Lyme. However, it's not just Borrelia. There's all these co-infections that are there, and there's a lot of chronic viral infections that come out when someone does get sick with Lyme. So sometimes Lyme's a straw that breaks the camel's back. And I think that sometimes this COVID infection becomes the straw that breaks the camel's back. And that's why you get these people with mostly underlying medical conditions that actually become, unfortunately, the victims of this infection, while others may not, manifest it that much. So When we treat chronic infections, that's really, really important. So we're also doing things like frequency therapies for patients here, either here or remotely sometimes, but also biomagnetic pairs. It's a whole topic. Hopefully we can get on to discuss that at some point, because you can locally change different pHs where these critters hide out and effectively knock them out. And I encourage everyone to go to our website, www.wholebodymed.com, where you can go to the section called medical and therapies offered, and you'll see under there about biomagnetism and some of the other things I'm going to be talking about today. So that IV therapies, and we're even giving people some extra discounts now, because we just want people to get in if they can get their nutrient therapies, IV therapies. That's really important, and anything else. So those are just some of the things we're doing for our patients. And I know one of the topics you want to talk about today was the brain, and the brain is probably the biggest immune organ. You're saying, what? How can the brain be a big immune organ? And you said you had a guest on that, mental health professional, right?
Yes. Yep. Monday.
Okay. So I'm sure you guys talked about stress and things of that nature, right?
Of course. Mm-hmm.
So stress, and some people have anxiety, depression, and all this. This is before COVID. This is before
Oh
this
yeah, totally.
national pandemic, and so this is just feeding upon it. But what's very interesting, and this brings us back to the times when I was training with Dr. Margaret Ayers, who really is one of the founders. There's only a few people in the world who founded the whole field of neurobiofeedback or neurofeedback. And I studied with Dr. Ayers, and she was the first one to clinically treat people with various conditions in the field, so to speak, like attention deficit, traumatic brain injuries, coma patients, a lot of different varied types of neurologic conditions. But sometimes she would also see people who were suffering from immune disorders such as mold toxicities and whatnot. And Margaret was very, very smart, very astute, and she would be looking for patterns in the brain that can show us some of these infections and everything using her specialized EEG equipment. But one of the things that she found was that, and she rightly said so, is that these immune patterns that would show up if we train the brain to help the hypothalamus, okay, the hypothalamus, to help that out, that would in turn help the immune system. Because it's the brain that's telling the immune system a lot of times, it's not necessarily consciously, but subconsciously, even in the deeper, more primitive brain structures, where to effectively send the troops. And and we all know it's just such a broad topic. And the mind-body connection has now been talked about for quite a number of years. But we know the gut-brain connection. So
Yeah, we talked about that yesterday.
Right?
Yeah, I had
So
Katie Fearson on. Yep.
So you have to deal with the gut too. So these are things we're dealing with our patients as well. If we can heal their gut, do anything to heal their gut, that's going to make their immune system much better. So while everyone thinks that's like to treat an infection, or is like, oh, you have to find the right drug or the right vaccine or whatever. I mean, you're sort of missing the point. Infections come in and take hold in a place where where it's hospitable for them. So we're all about trying to remove those obstacles, and it can be multi-layered. So even when we're dealing with the brain, we're always looking at everything. And I constantly have people come in, they're like, oh, I got attention issues, I got sleep issues, what? And I'm looking at their brainwave patterns, and I'm also looking at other factors. What about toxicity? What about chronic infections and head injuries? And the list goes on and on and on. But so just getting to stress for just a moment, okay? Let's say someone has a very primed brain for having anxiety, all right? Now you add more stressors in their life, they're getting even more anxious. Now, what you're going to see at the beginning in a brainwave state is that they're going to have an excess amount of beta activity in the areas that shouldn't have that activity, or get stuck in that state, shall I say. And what we try and do is actually train that down. But eventually, because it requires a lot of energy to be under stress, right? You've heard of fight or flight. So
Right.
fight or flight, it's, you know, that's a real state. And some people kind of get locked in that brain state that you have to actually help them get out of it. But what this does also physiologically is this increases things like adrenaline, noradrenaline, you know, epinephrine, everything like that, increasing heart rate, you know, that's the fight or flight state. And what does that also do? That puts stress on the adrenals. And what are
Yeah.
the adrenals? What nutrients is one of the most important nutrients for the adrenal glands? Ascorbic acid, vitamin C. And what we're saying, you need to, for health wise, you want to use vitamin C because that's also helping the adrenals, which also gets depleted during illnesses. So if we can help this out, you're going to also help the immune system out. So this is like a perfect time actually for people to start thinking about, okay, what can I do to, you know, calm my central nervous system down, which allows everything else to work much better.
Yeah, I mean, it's just amazing to me how everything is so intricately related, you know. And I think what I love about these last two calls is that I think most people don't realize, or certainly aren't thinking about, how the interplay of gut health and also brain health in how your immune function works. And it's huge,
It's huge.
huge. Yeah.
It really is. Yeah, absolutely.
Yeah. So that's interesting. So let's talk about enhanced brain performance. I mean, what kinds of things are you doing? You wrote a great article, I believe it's a couple months ago, uh, on the brain and all the different techniques and modalities that you guys are doing. So
Mhm.
anything that you want to touch on, I think would be great.
Okay. Well, let's just start with the basic. You know, well, when someone comes in for an assessment, whether it be a kid who's having trouble focusing in school, or someone's having insomnia, someone is having a traumatic brain injury and they need to heal, one of the things we first do is an EEG baseline. Okay. What that basically is we're measuring the brain waves to see if there's any dysregulation there. Okay, this is going all the way back to Dr. Ayers, who studied under Barry Sturman, who was the guy who started this whole idea of feedback training to the brain, or biofeedback to the brain. But first you have to see what it is. You know, you can say, oh, this is great. We're just going to, you know, everyone who has attention deficit has this area of the brain that's going to be off. Well, that's just not true. Right.
Right.
And so we have to look into a lot of different aspects of that. So an EEG baseline is the first thing that we do. And we look at the raw data. We actually look at the little squiggly lines on the screen, and you know, try and see what's going on with that. We also are doing what's called a quantitative EEG brain mapping, which we're comparing this to databases across age and gender, to see if they're out of range, so to speak, a standard deviation is out of range, out of power, how's the communication networks working. Some We'll also sometimes look at the Loretta imaging, which is sort of the deeper brain structures and how they are, because you know, when we're measuring with the cap on the head or electrodes on the head, um, that's the surface that it's almost like putting little microphones on the surface of the scalp and listening in, and we're amplifying that with an amplifier, and then it shows up on the screen of the computer. That's it. It's called an EEG, electroencephalogram. An EKG is the same kind of thing, except it's electrocardiogram, or ECG,
Right.
just different areas. Okay. And it's a matter of how you look at them. And so we're comparing that. We're comparing these databases. We're looking at raw EEGs. We're looking at, you know, does anything just seem out of place? And then, of course, a very thorough history and physical, trying to figure out what else is going on with the patient. I mean, sleep. A lot of times I could tell just by a person's EEG that they're not getting a good sleep. And then we start looking into that. And we have an online sleep assessment that we use sometimes, which for a lot of people is a great tool because it, it lets them know, you know, what the actual efficiency of sleep is. All right. Now, a lot of people have, you know, different Fitbits and all these tracking devices for their sleep, but that actually doesn't necessarily tell you how efficient your sleep is,
Mm-hmm.
and what other things in your environment may be impacting your quality of sleep. So someone may only be getting like 7 or 8 hours of sleep. Well, that'd be great, but most people are getting less. But it's not just that. They have other factors that are impinging their efficiency of sleep. So they may only be getting like let's say 60% efficiency. So those 6 hours they get they really need like 9 or 10 hours at that
Right.
same efficiency state. So we talk about that. We look at their diet. We look at other things, going to the gut, and toxicities, really important. We test for toxins, and there's a few different ways of testing for these toxins. One being EAV testing, electroacupuncture according to Vol, which we're measuring on the acupuncture points with a device that measures the impedance and conductance along the meridians. Okay, and then we can then search for signals that may be causing imbalance in those meridians, so that can give us sort of like a signal detection, if you will, of certain things, everything from an infection like Borrelia or Epstein-Barr, or whatever it is, to let's say mercury or pesticides or whatever. And we want to reduce that in the body as much as possible. Sometimes we'll also test something we have on a LIGO scan. I don't have it right next to me, so I can't show it to you, but it's it's literally a spectrophotometer, which means that's how chemists measure chemicals in a lab. It's high power light shines in and lets us bounce back and see the peaks absorptions of these different minerals and heavy metals, and we can start getting a sense of what people have in their body like that just through the skin. It's really amazing. And then maybe we do other blood testing. We may do looking at nutrient values within the blood, again, maybe food sensitivities or allergies. And then finally, we also may do neurotransmitter testing. Okay, so what that means is, we can measure urinary neurotransmitters, which, of course, what people know of certain neurotransmitters like serotonin, GABA, things like that. So we're going to be looking at all these. Now, it is a urinary, we're not measured directly in the brain, the neurotransmitters, but there's, good data out there to say, okay, if we're seeing it high or low here, we can infer what's going on in the rest of the body. So we can get a good sense of where this person may need to help enhance themselves so that they can start healing their brain. So I'll let you ask, and then wait a minute, then there's, of course, let's say someone has a traumatic brain injury.
Yeah, I wanted
Okay,
to
so
touch on that. Yep.
we could talk on that too, but I keep talking, so I'll let you
No,
ask any question.
so I was going to go, let's do TBI. And then my next question was going to be just, so just from listening to what you're saying, I feel like certainly people who are presenting with some sort of brain issue, whether it's concussion or TBI or, some other trauma to the brain, of course, should have this done. I feel like also, why wouldn't just the average person have it done? Why wouldn't I have it done? I mean, I feel like that, how do I know that I couldn't enhance certain things, like you're saying, like my sleep, or like, I don't really feel like I have ADD, but maybe I could get more focus in my day. Or maybe, there's so many things I feel like would be great for someone who doesn't necessarily present with an issue, but wants to improve.
That's absolutely 100% right. In fact, just as a jump point to the TBI, if people baseline themselves and their kids, so we actually have a record of where their brain is. If you feel, okay, everything's pretty good right now, like, my kid's fine, they're not, or they're doing okay, or I'm doing okay. Well, but what happens if you get an injury?
Mm-hmm.
Then you have something to compare back to. Because, hey, guess what? You just took your brain and took it X number of standard deviations away from normative here. And so we can actually, see that. So that's an amazing thing with the brain itself, and just doing an EEG. But absolutely, can you enhance yourself in any which way? Let's just say, we can brighten your brain up a little bit, give you a little better focus and attention, or calm you down. And then we could do that fairly quickly, because some of the things that we're doing is not just the idea of neurofeedback, and I can describe that in a moment, but is also just actually stimulating the brain to the frequency we want to get it at. Okay, so this is like a more newer field in neurotherapies that are being used clinically now. Some people may have heard of something called TMS, transcranial magnetic stimulation, which is a very strong magnet to help people get out of severe depression and they're doing that over a specific area of the brain, usually not EEG guided. So some people, it helps tremendously, other people it doesn't. But what we'll do is we'll use magnetic fields and microcurrent electrical fields to help get the brain into where it needs to be with certain frequencies and power. And that can happen very rapidly. So if you're, Diane, you're not here, but if you're here, I can like literally hook you up, and in like 20 minutes, I can have you probably feeling much more bright cognitively, or I can just calm you down very quickly. And what this does with repetition is it helps the brain entrain to those frequencies to help it get out of that stuck state, okay? Because the brain always is moving in and out of frequency states. You close your eyes right now, you go more in the internal reflections, internal network, and the different certain brain waves go up and other brain waves go down. Different areas of the brain light up versus when your eyes are open. Okay, when you have to do the external attention network and you have to start seeing the whole world, and your occipital parietal lobe is lighting up because the visual field is just taking all this information in. It's very different than when your eyes are closed. Also, the difference is if you're relaxed and calm, sitting back, and now you have to take action and pay attention. And then you're supposed to be able to relax again very quickly. You know, people like fighter pilots and such, they're cool cucumbers. They're able to do what they need to do and then come right back. That's a flexible brain, you know.
Right.
Someone
they have the
who's
fight or
not,
flight mode. they have the
fight or
like an animal, essentially.
Yeah.
Like they have it in perspective where it should be. Most of us live in that constantly.
Exactly. So if you are able to, I kind of liken the brain to an orchestra. Now I just remembered Dr. Ayers wrote a book years ago. It's called Symphony of the Brain, because that's what it is. And so you have the bass section, like the delta waves, which is the slowest, deepest waves, you know, for deep brain structures, like it'll, you know, 0 to 3 or 4 hertz, like 1 to 3 or 4 hertz. That's the range of it. There's even frequencies lower, 4 to 7 hertz being theta. Okay, so delta being deep, deep sleep, theta being sleep, also helping with your memory. Okay, and then you have your alpha, 8 to 12, 8 to 13 hertz. That's more of like the calm, ready state. And then you have beta above that, which is your action waves. And then you even have high beta and gamma. And all these waves, you know, go together. They all flow together, and one wave, you know, carries the information of a lot of other waves on top of it. So, but it's a matter of moving in and out of state. So just like if you had an orchestra, you don't want like a really high brassy, you know, exciting music playing at night when you're trying to go to sleep.
Right.
You know, that's like, you're not gonna be able to slow the brain down. Or if you're trying to pay attention at work or at school, and all you have is these slow boom, boom drum beats, you're going to probably start getting like that. And that's a lot of times the attention deficit disorders, they can't focus because that part of their brain is sleeping, basically.
Right. It's not that the professor's not interesting.
Well, their brain's sleeping sometimes too, right? So basically, we're helping the brain become more flexible and giving it what it needs so it can start in training to that. And then comes the idea of feedback or neurofeedback. Now, people might have heard of biofeedback, you know, for instance, doing things where you're doing breathing with a certain pacer or something to help your breath slow down. That's going to affect the vagus nerve, which, you know, is part of your brain, and help blood pressure and all these other things. That's part of biofeedback, or learning how to increase or decrease your pulse rate. Okay. Now, biofeedback at the brain is called neurobiofeedback, because what you're actually doing is you're taking the brain itself, the frequencies of the brain, and you're showing the brain which frequencies it needs and which ones it doesn't. And every time it does the right thing, you're giving it a feedback. Okay, you're giving it actual information to correct itself, hence neurobiofeedback. And so we'll even do the stimulation and things with the brain, and then we'll take like little pauses, and we'll just tell the brain, okay, I want you to train. You train. Get it? Okay, now you got it. And these new neural pathways start, and they start forming, And, if the person does have an injury or infections or things like that, that can throw the brainwaves off, that'll be permanent. So, and we even have now some home training systems that people can do in their home, which is, even great now during this whole crisis where people are stuck at home.
Mm.
Once we get a sense of what we need to do with their brain, we can actually say, okay, do some training here, but let's say you can actually do some training at home on your home computer, and it really makes a huge difference. And we can track that by doing new baselines along the way.
Yeah. So I don't want to, we mentioned earlier, I don't want to forget, we briefly touched on TBI.
Yes.
So let's get into that. What are you doing? How are you treating that? And, what should people know?
Well, traumatic brain injuries, there's a range of your mild traumatic brain injuries, which most people are more familiar with. The very severe ones where they are, let's say, have open head wounds and things like that. That's also, we're dealing with those types of patients. But a lot of people have dealing with, what people might think of as a mild concussion or even severe concussions.
Mm-hmm.
And that is when you're getting a literal injury to the brain. And it might not show up on an MRI or CAT scan because there's no big massive tear or something in the brain, a big bleed in the brain, but there's micro tears of the neurons. And that creates an inflammatory cascade. That creates, anytime there's injury to the brain, whether it be a TBI, a stroke, or anything of that nature, you have a change in the speed of the waves of the brain and the amplitude. And you have a massive inflammatory cascade. Now that brings us all back to some of the things we were talking before.
Yep.
The gut, nutrients, detoxification, chronic infections, and things of that nature. So for TBIs, we were the first in the region, and really, I believe, the only still to have true hyperbaric oxygen therapy to help treat traumatic brain injuries. And what hyperbaric oxygen is it's oxygen under pressure. So, and we actually combine the two, reawaken the brain, retrain the brain. It was the first one in the world to bring the two together, of hyperbaric oxygen and neurofeedback coming as a team together to help the injured brain. And so basically what happens is that someone is going in the hyperbaric chamber. Our hyperbaric chamber is a solid unit. It is the kinds they use in the hospitals for treating chronic wounds, non-healing wounds, carbon monoxide inhalation, severe burns, things of that nature. That's what a hyperbaric chamber is traditionally used in most of North America. However, Dr. Richard Neubauer, who was my mentor, who trained me, basically, he brought to the world the idea of hyperbaric oxygen for neurological conditions. Because hyperbaric is like, if you just think of oxygen for a moment, oxygen is, if you say, well, how can it treat so many things? And I can start listing everything from fibromyalgia to just up and down the line, autism. It's because oxygen is the miracle molecule, truly is. Without it for about 4 to 6 minutes, without oxygen, you're done.
Mm-hmm.
So if you can increase that oxygen in areas where the oxygen has been decreased due to injury or stroke or whatever it might be, if you can increase that, you're going to increase the metabolic rate and the metabolic activity of those neurons. But it's gone beyond that. We know it's way, way more than that. It's actually a genetic therapy. That every time someone gets a increased oxygen under pressure, okay, so someone goes in the chamber, we're sealing the chamber up. It's clear. You can see all around you. It's
yeah, I've seen one. They're cool, actually.
They're really cool.
We're launching a magazine in Naples, Florida. There's a functional medicine practice down there that has 4 of them. So
right.
I actually got to go in and see. Yeah,
you got to see hyperbaric.
Yeah. I didn't try it, but I saw exactly. What I mean. It's not like it. People might think, oh, I'm in the enclosed space, but it didn't look like that at all. Like you said, everything is clear.
It's clear. We have a TV outside, so people can
they're all hanging out watching TV.
right. I mean, we're taking all precautions because it is 100% oxygen environment, and we have, do have things that we say, what people can and can't have in the chamber, and what type of people may not be able to go in. But for most people, it's fine. We've had little babies go in with their parent. We've had, up and down the line, very old people to very young, and it's a very safe and easy therapy. And the sensation you feel is really just the pressure in the ears type of thing, like you're going up and down in a plane, or if you're underwater, being able to have to clear your ears, and so yawning, Valsalva maneuvers, things like that are going to help clear the ears. And what this is doing is it's taking the oxygen and infusing it into all the cells at a much higher concentration than you could do any other way. Even if you breathe oxygen, you can't do it. So if we took you down to 2 atmospheres absolute, which is about 33 feet under seawater equivalent, and the hyperbaric is like a lot of lingo from the diving world. But if we take you down that deep, and we were to take all your red blood cells out of your body, just leave the plasma in there, you would still be alive. That's how much oxygen there is. Wow. So what it's doing is it's allowing these areas that don't have enough blood perfusion or have had injury to start increasing the metabolism and start healing. Because what it's doing, and I mentioned it's a genetic therapy, because it's over 8,000 genes are turned on or off in just a single session. So anti-inflammation, so the inflammatory cascade is starting to get turned off. Healing and repair, starting to get turned on. Stem cells are increased by a lot, okay, like a 10-fold increase that the University of Pennsylvania did a study a number of years ago. So that means stem cells are circulating. What those cells are the cells that could become other cells. So you need to grow up, but can you grow neurons? Well, that was a good question. Are new nerves getting, new neural pathways occurring? And it turns out, yes, that it actually is occurring, that new neural pathways are happening after hyperbaric oxygen therapy. And you have to do a number of sessions, something that people don't go, I'm just going to jump in and my head injury is going to be cured. No, you have to do consistently, consecutively, 5 days a week is where all the research is mostly done on, once or twice a day. And, we've had people do it less than that and they've still gotten results, but, I always tell people, listen, most of the research out there is based on this particular protocol, because that's actually because that's what they do for other wounds too. And this starts healing the brain. It starts waking it up. I mean, we've had people, you can go on our website, you can start seeing some videos of some other patients, like Florence and Tito, and you can see some dramatic improvements in some folks. I mean, not everyone's going to have miracle results, but we've almost seen almost everybody has ever come in has had some results with hyperbaric. And excitingly, over the past few years, we've also introduced another protocol that involves the hyperbaric, involves intravenous nutrients, and involves something called platelet-rich plasma, or PRP. And we're able to introduce this in a way that the brain is now able to get that great healing, rich nutrient, collagen forming matrix, and also some other things that we add in it that helps stimulate neuronal growth in areas like the hippocampus, which helps with memory. And so we're having people that, I mean, it's pretty astonishing how sometimes they're just like really, really help with that. So the hyperbaric is really, prepping the area. And of course, there's even things like stem cells out now. So it's pretty exciting what we can do to actually help. So it used to be traumatic brain injuries. They said, well, just rest. Just rest. You'll be fine. Go in a dark room. Don't do this or that. And there's some new evidence to show that people really probably should be doing some exercise if they can after athletes concussed, probably because it's helping the
blood flow and everything.
Blood flow. And we also know now that there is a lymphatic system. They just discovered a new part of the body a couple of years ago. For anyone who wished to know, you thought we knew it all, but no, they found it's lymphatic. So there's a lot of things that we know people need to do to help any type of concussive injury. But it's very important to know that any injury is an injury, and it may leave that impression on the brain. So EEG, we do an EEG to see what's going on. We want to see it being resolving. We also want to help the brain retrain itself so it can, reconnect the networks and everything. And each concussion is cumulative. Okay, so you get one concussion, You may be fine to get another one, and then another one, either minor, might be major, and then you have all those other injuries that have sort of piled on top of each other to create issues. So, very
Yeah.
important to heal the brain.
Well, look at so many professional athletes like football players and boxers and that kind of thing. I mean, it's, now we're seeing what the impact of that was. All those
Absolutely.
concussions. Yeah, definitely. You
Uh,
touched on memory. I wanted to ask you, are you finding anything with dementia or Alzheimer's patients?
yes, and they can be helped, and there is, even clinical published, studies out there of, case studies and whatnot of this helping the Alzheimer's, dementia. Now, I would say that there's also a multifactorial issue going on there. We do know there's some genetic predispositions like, the ApoE4 and things of that nature. There's also toxicities.
Hmm.
Okay, that's really, really important. So one has to look at what their toxicity levels are. Heavy metals is a big one. Okay, and you got to look to the mouth, whole body dentistry here, because that is going. Someone has mercury fillings in their mouth that's going right to their brain, and that's
Yep.
accumulating over the years. And so that's one of the things we want to help reduce as much as we can. Chronic infections, all right, spirochetes like Lyme and other periodontal infections will have been found in the brains of these Alzheimer's plaques. So again, go back to we keep talking before, chronic underlying stealth infections, viruses. I mean, we don't even know why everyone would get it. And of course, um, uh, brain injuries. Okay. So that will further lead to it. And it really is a matter of when you catch it in the process. The earlier you can do that, the better.
Yep.
If you get them like later on, hopefully maybe you can stabilize them, and that we've definitely seen in the more progressed cases where they gain some stuff back and they're more stable. That's amazing. If we can get them at the earlier stages and do all these other interventions I'm talking about, I mean, we see people, like coming back, get their memory is starting to come back, their personality, like all those things. But there's a lot to go with it. There's different nutrients that you probably want to make sure they have. There's a big thing with ketogenic diets now, which is also good for the brain. So yeah.
Yeah. And sleep too. I mean, I've seen a
Oh
lot
yeah.
of research to do with people who have sleep apnea and just
Yes,
not getting enough oxygen to the brain, having that be a precursor too.
absolutely. And we've
Yeah.
had plenty of cases where I've had patients come in and I'm looking at their brain waves, I'm looking at, their airways and things like that. And I'll even send them, for instance, over to my father's office to get a head CT, a cone beam, low radiation head CT, which will also let us look at the volume of the airway to see if they have a restricted airway. And then we have them probably go through a sleep study, because and for some people that makes a huge difference. And though I have seen people do some of our therapies and even their apneas and things like that resolve too. So there's a lot to do with that. But one can't overlook restricted airways and somehow being able to work on that too. Absolutely.
Right, right. But I have to keep coming back to like just prevention. I mean, everything you're saying makes me feel like somebody who's, maybe even in their 40s or 50s without any symptoms should start looking at these kinds of
Absolutely.
things.
Yeah.
Like,
Yeah.
yeah, don't wait.
Don't wait. There's no
Right.
need to. You'll have less stuff you'll have to do now, or
Yeah.
maybe you have more things that you do now, but that's going to prevent you later on. Let's say we have to do, chelation on you or things of that nature, or getting out those chronic, infections and everything. I mean, that could just make a huge difference. And forget just the brain. I mean, it's the whole body can start feeling better. And so so, people say, oh, I'm just getting older. Oh, I'm
Yeah.
not remembering things. That's a cop out. It shouldn't happen. There's no reason why someone who gets older should have memory issues or can't find their words. And it's just not, that's not how the brain is supposed to behave. Yes, you can lose, some gray matter or whatever over time perhaps, but, you should be able to be pretty good. And if everything is optimized, you're not going to have those. Like, so for instance, microischemia. Dr. Neubauer talked about a lot of these patients who are dementia patients actually have microvascular diseases. In other words, they're not getting the proper blood flow to their brain. Okay, so everyone's worried about like coronary heart disease and all of that, and obstructive arteries, and one has to be concerned about that. And they talk about cholesterol being the big thing. And that's a whole other discussion
Yeah,
about
well,
cholesterol.
that's another hour talk.
Yeah, but think of it. I'll just give you this real quick. Think of it like this. It's about inflammation.
Yep.
Chronic inflammation leads to a lot of these coronary diseases. But don't forget, that's the big vessels going to your heart. Don't forget about the little vessels going to your brain. Okay, so if those start getting occluded or those are inflamed, so that the blood vessels just get, we're talking when you're trying to transfer oxygen to these little areas. Yes, you do have some larger arteries and everything, but eventually they become little capillaries. And the capillaries are little microvessels, right? And that's where the red blood cells, these little red blood cells that look like, like frisbees and almost donut-like, they have to march in, in a single file down those little capillaries so that oxygen can exchange. And at the brain, it's interesting because they got to exchange from those capillaries past the dura and then into the cerebrospinal fluid, and then it's got to go to the nerves.
Mm-hmm.
And then the oxygen concentration has got to be good enough there. So imagine if you got a tube, like, right, you're trying to water your hose, your garden, and you put a little kink in it, and now you're just getting a trickle of water out that hose. Same thing with these little vessels to the brain. So now you're getting just like a little trickle of blood to your brain, and all of a sudden, some of the areas that are affected by this a lot tends to be things like the hippocampal areas, which deals with memory. Oh my gosh, now you can't remember anything. Oh, I'm just getting old. Well, yeah, you're just getting inflamed and old.
Yeah.
And you're getting toxic and old. And you're getting, it's like the one colleague of mine said one time about people are, sick and these chronic illnesses. It's like a ship, like the barnacles on a ship. And, like a couple barnacles aren't a big deal. And, but if you don't start scraping those barnacles off over time, that ship that should, last 50, 60 years in the water is, after a few years, it starts eating away at the hull and then it sinks.
Yeah, right. Exactly. Take care of it now. My saying is for, like when I started getting into nutrition and supplements and holistic medicine and all this, I had a lot of friends that, didn't eat that great. And I would talk about organic and this kind of thing. And they would say, oh, it's so expensive. And my answer is, well, but how expensive is cancer? Or, these other types of diseases and issues that we're talking about.
Yeah.
So yeah, it's that you have to just have that long-term thinking mindset, I think. So for somebody who is interested in prevention, like somebody like myself, let's say, what would you recommend if I was going to come see you? What would you recommend I start with?
For brain or just overall?
Yeah, no,
I mean,
for brain, because we've been talking about this
yeah.
mostly.
What I would say is when a patient, and this is always the good question when people call the office, like, well, what kind of appointment do you book? I generally, for my initial visits, I'm sitting with a patient about 2 hours. And a lot of times we're doing the intake. I've always had people type up their narratives so that we're not sitting here on me trying to capture everything they say. Plus,
Right.
it puts them everything in a nice order. And so, because people tend to forget things, not even if they have brain issues, but like, like one year I had somebody here and we were going to the physical exam, and lo and behold, I was like, what's going on there at the leg? Oh, yeah, I had my leg amputated when I was like, whatever. I was like, oh, okay, that wasn't in
You
the
forgot to
narrative.
tell me.
Major medical issues, so that just helps us like get everything, chronological order, everything like that. So I take that, and then we're asking questions. We're going through and asking questions that most doctors aren't asking, or even looking at it from the homeopathic standpoint as well. The whole other topic of discussion, homeopathy. Right. So we're taking all that information. And then if someone's just like, okay, well, maybe we do a brainwave analysis at first, so they'll book in a visit with me, and then they'll do the brainwave, the EEG baseline. And then we kind of then decide, okay, do we also want to do the EAV testing, which I mentioned before? Are we going to want to do some nutritional and urinary blood analysis? Are we going to do the oligo scan? Are we going to do neurotransmitter testing? I can't like tell each person
Yeah,
this is what we do for everyone, because we don't.
exactly.
It's very individualized. But you just want to get a blueprint of like where you're at. That would be, I would start taking that information in, do the EEG, and be like, Diana, your brain, it's looking like, and also your intake, we got to work on the stress response right here. We can start working on your sleep,
Right.
right? Because you mentioned sleep, and sleep is a big deal. And I tell people, listen, if we're not going to help your brain sleep first, we're not going to be able to calm it down first. We can train your brain to try and focus all day long, but have you ever been up all night? And how well can you focus if you've been up all night?
Right.
So, that it's very individualized. Kids in school, I mean, this is a great time for kids to come in and get their brainwave analyzed and actually start doing training, because, these kids, their grades will jump up. They just will. They'll just improve because their focus and attention is improving. Their memory may be improving. And so it's so important to do this now. I mean, this is like the only time in history where everyone's at home.
Right. Yeah.
And so, people are coming in, and, we're taking all precautions, making sure that everything's being disinfected, and, we're keeping patients pretty much away from each other. And, but this is a great time to come in and, come into your individualized little EEG room, get your EEG done, and maybe do some neurotherapy at this point, or maybe even discuss, well, how can I, get a unit that I can start doing some training at home. And, maybe it's a family thing. Maybe like it's 3-4 kids, and, you only have to get one EEG unit, and each person can do some of their own training. For the adults can help the memory and focus, and maybe help their anxiety out a little bit. And, so it just goes, it goes on and on. The possibilities are sort of limitless
Yeah.
and how you can do to help yourself out now. And this is a great time to help yourself out.
Yeah. Definitely for all those parents who are homeschooling, they got to remember algebra and I don't know what else. So,
Exactly.
yeah. Well, this has been awesome. Thank you so much, Dr.
You're
Breiner.
welcome.
How do you want people to get a hold of you? Whether it be the website or phone, what information do you want to give us?
The easiest thing to do right now is to go to our website at www.wholebodymed.com. The information there for either calling medical or dental, the number's right there. I'll also give you our phone number. It's 203-371-8258. You're also on, Breiner Whole Body Health Center on Facebook. So I do suggest that people look on the Facebook page. And this is actually a very important point, because I actually was doing some special videos on the corona back in January. So we've been tracking this for a long time. We came up with strategies back then, so you can always go back to our archives on that. And we also have a YouTube channel and look at some of those videos. I did one with my colleague, Dr. Brady, about the other month, talking about things that people can do and help them, with their immune system prophylactically. And later today, I'm going to be recording a special interview with Dr. Paul Anderson, and he's one of the leading docs out there and researchers with intravenous vitamin C. And he's
Nice.
been doing this with cancer patients. He did an NIH study with cancer and high-dose vitamin C therapies. And we're going to be talking about that vitamin C itself, the sodium ascorbate intravenous vitamin C, helping with viral infections, immune, and specifically also the COVID, because we really want to get this out in the hospitals now. They need to be doing a high-dose intravenous vitamin C. And hopefully everyone can watch that and start learning why that is important, and we can get the ball rolling and educate people, lay people and doctors alike.
Yeah, exactly. Exactly. Well, thank you again for your time. All this information
Absolutely.
has been great. This video has been recorded. It'll be on our Facebook pages at Natural Nutmeg Magazine, and on our website, naturalnutmeg.com, and on Dr. Breiner's websites too. And thanks everybody for joining us, and hope you all have a great day.
Thank you.